Hi, my name's Dayla, and today I'm going to tell you about rheumatic diseases. So imagine being at the peak of your health. The next day you wake up and you can't walk anymore. Well, most cases aren't even diagnosed until it's severe enough. 50 million Americans currently suffer from some type of rheumatic disease. That's about 20% of the American population. And the American Allergy and Immunology Institute says that this is the worst debilitating disease, which is the leading cause of disability and death in the United States. So today I want to explain how this works. What is rheumatism? And myself personally, I have rheumatoid arthritis. A lot of people think that the arthritis part means that my joints hurt, but it's so much worse than that. So how it works is your white blood cells, which are your immune cells, usually fight off pathogens like bacteria, virus, protozoa, but my white blood cells and many other Americans, their white blood cells think that sometimes proteins in our bodies are pathogens and they start to attack them. And in my specific case, the proteins in my synovial fluid that cushion my joints, it attacks them thinking that they shouldn't be there. That causes inflammation to build up, and over time, wear and tear on my joints will cause me to probably end up needing surgery. This is also hard on my organs, my tissue, my muscle. And so that's why Euler.org explains that rheumatism is any disease where you find inflammation in the tissues, the muscles, the organs, and the joints. So there's different types of rheumatism, and that could be lupus, ankylosing spondylitis, scleroderma, rheumatoid arthritis. Those all have very different types of inflammation, but when it comes down to it, they all have the debilitating process which breaks our bodies down over time. Unfortunately, there's no cure right now, and so most of the measures that we take are to provide comfort to the patient. Some of the medication that we have right now are TNF inhibitors and biologics. And the American College of Immunology explains that if rheumatism was a war, biologics would be the sniper. TNF stands for tumor necrosis factor, and this is going to go in and stop your white blood cells from noticing the proteins in your synovial fluid. So that one's good, but there are some very bad side effects for TNF inhibitors and biologics. Some of them are hair loss, weight gain. You could go either way. You could also have an increased risk for lymphoma, and that's pretty scary. So you've got a lot of benefits to outweigh the risks and decide if that's the right medication for you. Some of us use a lot of steroids to decrease the inflammation, but then again, prolonged use of steroids can cause fracture in your bones. Depression is also one of the key factors in having an immune disorder, and 1/3 of the patients that get diagnosed with a rheumatic disease get diagnosed with depression at the same time. So those go hand in hand. So I want to recap what I told you guys today. I have a rheumatic disease which attacks the fluid in my joints, and 50 million Americans currently have some type of rheumatic disease. So it's breaking down the tissues in our body, but our own body is breaking it down. So we didn't catch a disease from outside. This is something our bodies are doing to ourselves. There's no cure right now, so we're trying to decrease inflammation, stop the process of the white blood cells attacking us, and then also hopefully find some way to comfort us from all the pain that we feel with that inflammation. Depression is also treated, and lucky for us, there are like antipsychotics and drugs like Celexa, which help you combat your depression. A lot of us don't look sick on the outside, and maybe yesterday we were fine, but the big deal with the rheumatic disease is sometimes you won't notice how sick we really are. Some days are worse than others, and we live every day to the fullest. Thank you for spending time with me to learn about this type of disease, and if you have any questions, feel free to ask me later. Thank you.